This is the entrance part of the program for the emergency medical services. So what they have learned here mostly is patient assessment. This is where we get to find out what's wrong with the patient and be able to determine what kind of care they need to be provided in an emergency situation, whether it's a medical emergency or a traumatic injury.
In this class, I learned how to properly treat a patient when they're in an emergency, and then I learned how to splint broken bones. I plan on using it because I'm going to work in the medical field, and it's going to help me a lot with my critical thinking.
This is a class that is intended for the student to earn a license certification after the completion of the program, which is the whole year of their senior year in high school.
I plan on taking the NRMT certification test so I'm able to work as an EMS service. And you get a certification for it to be able to work in EMS.
This course does have lecture, lab, clinicals, which is where we go to the hospital, and it also has write-outs at the second part of the semester where the student will actually be writing out in an ambulance. In the clinical part of this, the student is exposed to actual patients who are sick or injured, and it allows them to get patient contact, such as coming up to a person who is sick or injured and asking them things like about their medical history, what kind of injuries they have or injuries that they're going through. Basically a patient interview that any healthcare provider would need to perform in order to know what's wrong with the patient and be able to coordinate a plan of action to make that person get better.
It's really fun. You get to learn a lot of stuff and see stuff that you wouldn't normally see anywhere else.